Hello everyone, this is Dr. Sangeeta Chaudhary once again and I welcome everybody to my class. In my today's lecture, I am going to discuss about hypomagnesemia. That means the condition where serum magnesium falls below 1.3 milliequivalent per liter. So why magnesium is so important? Why it is important to know about hypomagnesemia or hypermagnesemia? Magnesium is very important for the neuromuscular function. If there is any alteration in the magnesium level, there will be alteration in the neuromuscular functions. 60% of the body's total magnesium remains inside bone. Only 1% remains in the extracellular fluid and the remainder is there in the intracellular portion, that means inside the cell. So actually what I mean to say is serum level of magnesium is not a very true marker for the total magnesium level in our body. Magnesium homeostasis is mainly maintained by kidney. If there is increased level of serum magnesium, there will be reduced renal resorption of magnesium, or if there is decreased level of magnesium, there will be increased tubular reabsorption of magnesium. Now, what are the causes of hypomagnesemia? Reduced intestinal absorption is one of the important causes of hypomagnesemia, which we can see in cases of chronic alcoholics or malabsorption syndrome. Okay, reduced intestinal absorption. One more important thing, that is PPI, proton pump inhibitors, also results in reduced reabsorption of magnesium from the intestine. So prolonged use of proton pump inhibitors like pantoprazole and all will result in reduced magnesium level. Increased loss through the GI tract may be due to prolonged diarrhea or nasogastric aspiration may result in reduced level of magnesium in our body. The other important cause of hypomagnesemia is increased renal excretion. So if there is increased tubular flow due to osmotic diuresis, there will be increased renal excretion, as well as in cases of impaired tubular function. For example, in cases of acute tubular necrosis, Bartter syndrome, Gitelman syndrome, these are known causes of hypomagnesemia. Now, there are certain drugs which may result in defect in tubular magnesium transport and ultimately resulting in hypomagnesemia. So, we need to know about these drugs because when we are using these drugs, we need to take care of serum magnesium levels. For example, aminoglycosides is a well-known antibiotic, amphotericin B, cisplatin, cyclosporin, pentamidine. So these are the drugs which may result in hypomagnesemia. Now coming to the clinical features of hypomagnesemia. As I said, magnesium is important for the neuromuscular function. So most of the clinical feature will be neuromuscular or neurological. So there will be a lethargy, confusion, tremors, fasciculations, ataxia, nystagmus, there will be tetany and seizures. So these are the important clinical features which we should keep in mind. And there may be various types of ventricular as well as atrial arrhythmias. Torsades de pointes is one of the classical arrhythmia which is usually associated with severe hypomagnesemia. How do we diagnose the case of hypomagnesemia? Of course, the serum magnesium level when it falls below 1.3 milliequivalent per liter, as well as the clinical scenario also will give us an idea about the diagnosis of hypomagnesemia. We need to do 24-hour urinary magnesium. If 24-hour urinary magnesium is more than 2 milliequivalent, or if it is more than 24 milligram per day, or if the fractional excretion of magnesium is more than 2%, that means there is increased renal excretion of magnesium, and then we need to find out what is the renal abnormality which is resulting in increased renal excretion of magnesium. There will be certain ECG changes which will also be helpful for the diagnostic purpose. Hypomagnesemia will result in prolonged PR interval, QT interval and wide QRS. And as I say, torsades de pointes is one of the classical arrhythmia which may be associated with hypomagnesemia. And in cases of hypomagnesemia, there is usually associated hypocalcemia or hypokalemia. That means reduced level of calcium and reduced level of potassium. Okay, as a result of imbalance in the homeostasis because of hypomagnesemia. So this is about the diagnosis of hypomagnesemia. Coming to the most important part, that is treatment. How do we correct hypomagnesemia? We can correct orally through oral route or by intravenous route. In asymptomatic cases, we prefer to give oral supplementation. How do we give oral supplementation? There are oral tablets which are available, which we can give at a dose of 240 milligram of elemental magnesium per day. In severe cases, we can give up to even 720 milligram per day of elemental magnesium. This was about asymptomatic cases. Now in cases of symptomatic, severe cases, what we do? We give intravenous supplementation of magnesium. We supplement in the form of magnesium sulfate. We can give 1 to 2 gram of magnesium sulfate intravenously over a period of 15 minutes. Now 1 gram of magnesium sulfate, it contains 96 milligram of elemental magnesium. We need to give the replacement therapy for at least 3 to 7 days, because as I have already mentioned, serum magnesium level is not a very good or true marker for the magnesium store. So we need to replenish the store as well, and for that purpose we need to give at least for 3 to 7 days of magnesium supplementation. And we need to take care that magnesium level is maintained below 2.5 milliequivalent per liter. In cases of hypersupplementation, or if there is iatrogenic hypermagnesemia, we will be able to say hyporeflexia. So we need to check reflexes every now and then when we are supplementing serum magnesium, because hypermagnesemia will result in hyporeflexia. Lastly, I just wanted to mention one more thing. When you are supplementing magnesium via intravenous route, you need to keep the rate of magnesium supplementation like 150 milligram per minute. Okay, so that is important when we are supplementing magnesium through intravenous route. Thank you. So this is all about hypomagnesemia which I wanted to discuss today. I'm sure this class will be very helpful for the exam going students as well as the doctors who are practicing. Thank you so much for hearing the class.